Internalized beliefs about aging carry a physical cost. When patients and providers act on negative perceptions of growing older, it translates into shorter lifespans. This chart captures the cost. Internalizing these biases cuts life expectancy by 7.5 years. Clinically, staff use patronizing terms like "sweetie." This condescension means clinicians often dismiss chronic pain as normal aging, causing severe undertreatment. Healthcare bias moves beyond poor bedside manner. Dismissing a legitimate symptom because of a birth year introduces a fatal flaw into the medical paradigm. This vulnerability in care is meeting a global demographic shift, often called the silver tsunami. By 2050, the over 60 population will double to 2.1 billion. Africa will see a 218% increase, and Asia 122%, bringing the total global average to a 110% rise. Millions of new patients are entering a healthcare infrastructure that was built to address acute issues rather than the specific functional needs of an aging population. Adapting to this population doubling involves moving past the basic chronological definition of what it means to be old. A central challenge in modern care is the reliance on chronological age. Judging a patient's capacity based on their birth year ignores the physical realities of the body. Rather than counting years, biological age measures actual cellular health and DNA integrity, tracking the physical degradation occurring inside the body. Gerontologists are instead turning to a more precise metric, biological age. Clinicians determine this using data shown here, looking at specific blood biomarkers and physical metrics like raw grip strength. This data shows that two people born in the same year can have vastly different internal health states, making a calendar birth date an insufficient tool for medical diagnosis. There is another metric that is even more vital for daily care: functional age. As illustrated by the man on the stairs, functional age measures a patient's capacity for daily activity and independent mobility. To test this, clinicians observe how patients navigate real-world tasks, such as carrying groceries or maintaining balance while walking. Tracking functional age is not an attempt to cure every age-related condition or achieve permanent youth. In fact, chronic conditions are the standard. 80% of adults over 65 are currently managing at least one chronic health issue. The goal of modern gerontology is to maximize a patient's independence and ability to function while living with those chronic conditions. Optimizing functional age shifts the focus from a single physician's perspective to a broader, collaborative framework. This illustrates a structural alternative: interdisciplinary synergy. The model coordinates physical therapists, occupational therapists, and geriatricians. Rather than treating symptoms in isolation, this multidisciplinary team works together to create a plan focused on total mobility and independence. Addressing functional capacity through these teams targets the core of the ageism penalty, reclaiming those 7.5 years often lost to systemic bias. By looking past chronological birth dates, the coming demographic surge becomes a manageable transition toward a longer living society.